Hello, I'm Dr. Ryan Combs, and I'm an assistant professor at the University of Louisville School of Public Health and Information Sciences. I'm going to talk to you today about health insurance literacy in real life, results from studies in West and South Louisville. I conduct research in communities that experience health disparities, and we recently completed 2 health literacy studies in Louisville that I wanted to talk to you about today. These studies will hopefully give you a better understanding of how health insurance literacy influences community members' experiences signing up for and using health insurance, as well as their preferences in how they receive health insurance information. We found these results very helpful in guiding providers on how to best deliver health insurance literacy services. If this sounds like an interesting and useful topic, please continue this module. If not, please feel free to progress to part 2 of our modules. The contents of this module are as follows. I'm going to talk through the goal of the research, who was involved in conducting the research, why West and South Louisville, who our participants were, what our findings were, and what our next steps were. First and foremost, our research aimed to examine the development, use, applicability, and design of health insurance, health systems, and health behavior literacy materials to residents of West and South Louisville. In other words, what works and what doesn't work when sharing health insurance information to residents of these Louisville communities. This research was really driven by some work that was done by the Louisville Board of Health, Health Literacy and Education Committee. The committee was comprised of researchers like ourselves, public health practitioners, social service providers, health insurance companies, and healthcare providers. After the Affordable Care Act, this group came together to strategize about how to improve the public's health insurance literacy in this changing healthcare landscape. We all wanted to better coordinate to improve the population's health literacy, and the group had some outstanding questions about how to best do that. That's where our research comes in. Briefly, I want to introduce our research team. This is myself on the left with a number of our graduate students who have worked in West and South Louisville, collecting information and stories, recruiting participants, participating in generating knowledge about these communities. And while we know the statistics on health literacy nationally, what we were most interested in was the situation on the ground in our city. What does it mean to try to understand insurance so that you can enroll in the right plan and use your coverage? And what are the barriers to accessing this information? We chose these 2 communities, West and South Louisville, because of the health disparities they face. In the map on the left, you can find West Louisville in the upper left-hand corner. West Louisville includes neighborhoods like Russell, Shawnee, Park Duval, California, and Parkland. So anything west of 9th Street and north of Algonquin Parkway. In the map on the right, in the box on the lower left-hand corner, you can see South Louisville. This includes neighborhoods like Shively, Valley Station, Pleasure Ridge Park, Fairdale, parts of Okolona, and the Iroquois neighborhood. And as I mentioned, we chose these neighborhoods because of the differences in health outcomes between these communities and other areas of the city. These communities are very different from each other, they face different challenges, but in the starkest terms, they are 2 parts of the city in which residents have the shortest life expectancy, as much as 13 years shorter on average than residents of East Louisville neighborhoods. As you can see, the West End has the lightest color. The life expectancy is the shortest, between 69 years of age and 71 years of age. And when you go down to the South End, the life expectancy improves a bit, but there's still a significant difference in the life expectancy between South Louisville residents and those who live on the east side of the city. The composition of these communities is quite different. West Louisville is a predominantly working-class African-American community, and the South End is predominantly working-class white, with a sizable immigrant and refugee community in the Iroquois neighborhood. We recruited participants to take part in focus groups. A focus group is essentially a facilitated discussion with community members. The topic was how these rapid changes in health insurance, have affected the community and how we can make health insurance easier for people to understand. Specifically, how can we ensure that information delivered is culturally tailored? There's no use creating resources that no one uses. We really wanted to tailor resources to the population. On the left-hand side is the flyer that we used for the West Louisville focus groups, and on the right-hand side is the flyer for South Louisville. Participants were provided with dinner. They were given an incentive, a $20 gift card, to participate as a thank you for their time. Participants had to be over the age of 18, they had to be residents of the area, and they had to be able to communicate in English. The groups lasted for about an hour to an hour and a half each. So here is a table describing who participated. We did the West Louisville groups first. There were 8 meetings and 87 people participated in the group. The average age was 55, and most residents had insurance. Over half of the residents were insured through Medicaid, and their average income was quite low at about $16,500 per year. A little bit later, we conducted 5 focus groups with South Louisville residents. In those groups, we had 45 participants. The average age was about the same as the West Louisville groups, 57 years of age versus 55. The uninsured percentage was roughly the same, 4.4% versus 2%. However, where they really differed was in terms of Medicaid enrollment. Only 13.1% of South Louisville residents who participated had Medicaid versus 60% in West Louisville. And this really corresponded with income. So these are not necessarily representative of South Louisville as a whole in the community, but you can see the difference in the income of those who took part. West Louisville focus groups were entirely African American, whereas the South Louisville groups were 71% white and 27% African American. As a caveat on the income, I would say that there were some income data points missing with the South Louisville group, so keep in mind that this is a rough indication of who took part and not necessarily representative of these communities overall. Next, I'm going to present the themes from our analysis. So focus groups are qualitative research, meaning research that produces data in text form. Each focus group produces a transcript of the discussion, which is a written record of what people said during the groups. As researchers, we review everything that was discussed, and we attach codes to each data segment. Then, we group these codes into themes, paying particular attention to similarities and differences in what people said. So here are our results. First, many of you will be unsurprised to hear that people in the groups perceived the healthcare system as being too complicated overall. Both our West and South Louisville groups talked over and over and again about the ways in which our healthcare system is confusing and complex. It's true that we have one of the most complicated healthcare systems in the world, so this theme certainly came as no surprise to me. Both groups agreed that both the healthcare system and the health insurance aspects of the system were way too complicated, way too difficult to understand. Here are some quotes to demonstrate these points. A West Louisville resident in the Russell focus group said, "You're so confused. There are so many different types, out-of-pocket, expenses, deductibles, and I mean all of it is just mind-boggling." A South Louisville resident also from the Fairdale group also agreed. "I just feel as though it's a whole lot more complicated than it needs to be, and there's a lot hidden that you learn as you go." This really highlights an area of health literacy that must be tackled. That is, residents need to be able to understand the very, very complex, especially the parts that they have of health insurance that they have no choice but to engage with. The second theme was that health insurance and healthcare were perceived to be too expensive. Both the West and South Louisville groups talked about the expense of health insurance, and even those who had insurance discussed delaying or foregoing care because of the cost. Even nominal copays constituted a barrier to filling a prescription. So, on to the quotes. A West Louisville resident said, "What happens when you don't have money? You don't go to the doctor." A South Louisville resident expressed exasperation at the cost. "I've got health insurance. I'm paying $100 every 2 weeks and my copay is $30. But you still don't go to the doctor because you're afraid to pay this $30 because you've got to pay rent. That's crazy. You're paying $100 every 2 weeks, then you need to be able to go to the doctor and that's it." In both groups, we talked about how not being able to pay copays, deductibles, and coinsurance was really keeping people from getting the care they need. Another theme that we found across both groups was the lack of trust in the healthcare system as a whole, and the health insurance companies in particular. The West Louisville quote says, "You don't know if your doctors are lying to you. They could tell you that you have a copay, and you really don't have a copay. You're just giving them free money, and they're already getting paid for the services." And then the South Louisville quote says, "I feel like all of them are for profit. The doctors, the hospitals, the insurance companies, so they all have their own agenda. So I don't have anyone I would say I could trust." An Okolona resident added, "Health insurance companies don't care about your health, they are for profit." This made it very difficult for participants to believe what they were told about what was covered and what was not covered. And this had a knock-on effect when it came to signing up for insurance or using their health care. The mistrust took many forms. West Louisville residents tended to distrust medical providers, whereas South Louisville residents tended to distrust the systems as a whole. The fact that many healthcare systems and most health insurance companies are for profit led residents to believe that they didn't have their best interests at heart. Participants also talked a lot about the challenges they faced when comparing plans and making informed decisions. And this was especially the case for South Louisville residents who were transitioning between employer-sponsored insurance and Medicare. In terms of enrolling in health insurance, there were lots of issues with people trying to enroll in plans. When people attempted to compare plans, it felt to them as if they were comparing apples to oranges. Here are some quotes. "I'm not old enough for Medicare, not poor enough for Medicaid, and not rich enough for private insurance." This individual felt as if they fell into a gap and didn't have any decent, affordable options available to them. And another quote. "To make them, a new insurance plan, custom to me, that's usually when I go, what's happening with me now? While I try to figure out what I can pay a month, what I can pay a year, how often I go to the doctor's office, can this go from state to state? So it just has to fit me." This person used a tactic that we found many of the participants used. In considering what plan was right for them, they considered their own situation and tried to anticipate how much they would be needing insurance in the next year. So in the last section, we discussed a little bit about the challenges of understanding healthcare. This next section, we're going to be discussing how people would like to learn about health insurance and what types of assistance they said would be most useful. There were several parts of possible ways of receiving information that I will cover. First, according to our participants, calling providers and insurance companies on the phone was an important option when people had a specific question. However, some participants felt as if information provided by call center representatives was unreliable. Some discussed how they might get one answer one day and one answer the next day, a different answer from somebody else. So using the phone was also considered very time-consuming. A quote from a South Louisville participant said, "If you use the phone, you're going to get, all our representatives are busy. All of our representatives are busy. You can sit on the phone for a representative, you believe me, for 2 hours, and finally you get angry and hang up." In general, phone was not a preferred way to receive information from either the West Louisville or the South Louisville groups. So what about written materials? Written materials include things like insurance manuals, and we found that in our groups that no one used the manual unless they wanted to look up the answer to a very specific question about what was covered under their plan. Some of them jokingly described using these materials as doorstops. For example, the West Louisville quote says, "When Medicare sends you these big old thick books out to about their different insurances, you can't understand all that." And a South Louisville quote also demonstrated the written material's lack of usefulness, saying, "They make great fire. I'm telling you, you can burn some good wood up in there." So written communication was not considered especially useful when compared to other types of communication, such as oral communication that will be discussed later. What about more simple written materials, such as comparison charts or tables that demonstrate the differences between plans or concepts? Both the West and South Louisville groups were looking for comparison charts because they were easier. They were comparing apples to apples with very brief written information. They weren't overwhelming. One group member said, "The one thing I think does help, even though this is a flyer, the bottom line is it is a nice thing, just a one-page comparison chart." So what about online resources? Online resources were considered useful for those who already had computer literacy and access to the internet. And many of those who participated in our groups liked online resources, but there were still several who could not afford internet access, and some barriers with older people in terms of lacking computer skills. In terms of the quotes, a Valley Station participant said, "Go online to Medicare.gov and you can actually compare like 3 different policies at the same time, and they will tell you what your co-payments will be and stuff." This goes back to the idea of comparing apples to apples in selecting a plan. The second quote demonstrates what the experiences of older people are. But here I am, 64, and my aunt, who is 85, is like, "iPad? What? Cell phone? What? Give me that telephone." So you can see the difference here between someone who's more computer literate and someone who's less computer literate. It stands to reason that online resources should be available, but this still includes some key constituencies, such as those who don't have the income or who may not have the technological skills. So I want to walk you through this table, which describes the different information delivery preferences among our 6 focus groups that were held in West Louisville. And you can start to see some consensus around whether residents felt positively or negatively about different ways of delivering health insurance information. You can see a lot of no's around. You can see a lot of a mix of yeses and no's, but I'll walk you through this chart now. Residents were positive about 2 types of health insurance information delivery. I'll talk about one now and one at the end. Every group except Shawnee expressed an interest in short brochures. These included comparison charts, and often people were discussing having these brochures available in places like health facilities where people could read them as they waited. However, long handbooks were universally disliked, and call centers or any kind of automated calls were also universally disliked. People would not necessarily open mail that they didn't recognize, so that was not considered a good option. Some people got information from friends and family, but this was really mixed because some other participants did not get information in this way. And in terms of the internet, it was liked by all groups except for the over 65s. So I will have a caveat, insert a caveat here that people who were looking for internet information did not necessarily use a desktop computer. Many of these folks were using tablets and smartphones, that sort of thing. So any sort of resource that was designed for internet usage should be optimized for tablets and smartphones. However, the most clear and universally liked method of getting health insurance information was through a one-on-one support through a personal navigator. So yes, far and away, one-on-one help was the preferred way of getting health insurance information. West Louisville residents especially preferred oral communication over written communication. And here are a couple of quotes that related to that one-on-one help. In West Louisville, a participant said, "I want to bring my bill, I want to bring my health care coverage. I just need somebody to explain to me what this one paragraph is really saying." Sometimes you can do that on the phone, but it's just better if you can converse back and forth face to face. In South Louisville, a participant concurred, saying, "It's more personable too, it's more human. Face to face, I think that's wonderful. Personal navigation would be awesome." Personal navigation was strongly preferred as long as it was accurate. It was often described in combination with other resources, such as explaining written material. People wanted somebody who they could just check their knowledge with. All right, I'd like to share some of our recommendations. After conducting this research, we saw a clear mandate to increase the role of community health workers in providing in-person assistance for developing health insurance literacy skills and helping consumers to navigate this very complex system. This is especially key at the point of selecting a health insurance plan, when trying to find a provider, and when trying to understand or dispute bills. The research participants emphasized the importance of having a personal navigator who was neutral and unbiased. In other words, they did not want the person providing in-person assistance to be affiliated with a particular health insurance company because they didn't want to receive information from someone who would financially gain. They also wanted information about what plan would be the best match for them. They want to access folks who they can ask questions of if they run into problems. This quote says, "Insurance is very complicated. It's hard to understand, and I'm glad that someone thinks enough of us that they want us to help navigate the system." Community health workers need to have health systems knowledge, which is a big part of what prompted us to put together this training series. In addition, residents want somebody who has community knowledge and cultural awareness. They wanted an insider to help them with this information. They also wanted the information to be delivered in a situation where there was plenty of time, and they wanted a named person who they could come back to over and over again if they had any follow-up questions. Participants identified several attributes that they desired in a personal navigator, and these came out of the discussion of the West Louisville groups as well. Participants wanted people who had some great customer service type skills, such as being welcoming, polite, and courteous. And they also wanted people who would be truthful with them, who would be understanding, who would express concern and compassion. Again, they don't want a person who was hurried or rushed. And finally, participants wanted their personal navigator to be a great communicator. They didn't necessarily need to have any personal experience with Medicaid or a particular insurance company, as long as they had the knowledge and were good listeners and good communicators. I think these are things that we can really all agree on, that we would want these attributes in a person who would assist us. And our research team concluded that community health workers are in a really great position to fill this role. So what were our next steps? After conducting this research, we presented our findings to the Louisville Board of Health because we really wanted to keep health insurance literacy high up on the agenda in our city. We also added health insurance literacy assessments to a needs assessment program in West Louisville staffed by community health workers. This is a Louisville Urban League initiative called It Starts With Me. We wanted to make sure that health insurance needs were a part of the needs assessment, and so if residents had these needs, they were flagged, and this prompted referrals to people who could help them sign up for health insurance and answer any questions. Third, we developed this training series for community health workers. That's what this training series is all about. Getting community health workers trained up on health insurance and health systems literacy so that people all over the state can get answers to those very important health insurance questions that they have. And really, the idea is to optimize their health insurance. Just a couple of quick acknowledgements. This research was supported by Kentucky One Health. We want to acknowledge our partners at the Health Literacy and Education Committee of the Louisville Board of Health, and also the Louisville Metro Department of Public Health and Wellness, who have been working with us all along the way. They helped us to design our research flyers, they helped us to recruit, and we really cannot thank them enough for helping us conducting this research. So I hope you now have an understanding of the important role that community health workers can play in improving the population's health insurance literacy. I hope that this has been helpful. Please reach out to me with any questions that you have about this research or the series as a whole. Thank you so much for joining us.